welcome everybody. We're just waiting for a few more people to join and we'll get going. Hopefully, we'll have more people joining us. So we'll just wait about 1 more minute and then we'll start. So while we wait, just wanted to ask if you could please make sure to turn off your microphone. So make sure your microphone is off. You can certainly turn on your cameras. It'll be lovely, especially during the question and answer period. And, you know, it helps to see who I'm talking to. But please hold all the questions until the end because I can't see them while I'm doing the presentation. But I promise I will answer all the questions that you have. I do want to start by saying that at the end of the presentation, we're going to go over a sales pitch. Oh, yeah, I'll try to make it small. It's just my brand new course. It's called Functional Nutrition, and it's being offered. Tomorrow will be the last day to sign in, and it's being offered at a discounted rate. All right, well, I think we're you know, a minute past, so we'll start. Hopefully people will still start coming in as we are going. All right, so today's topic is what is functional nutrition? So a little introduction. So my name is Alexandra Santa Maria. I am the founder and CEO of RX Health and Wellness, who's bringing you this presentation. I'm also a doctor of pharmacy. I'm certified in diabetes care and education, and I am currently getting specialized in functional medicine as a practitioner. And I want to specialize in cardiometabolic treatment. So hopefully you'll understand a little bit more about that as we go through the presentation. I also want to say I am also a mother of 2 young ladies, and I am a grandmother to a 5-year-old girl named Camilla. So before we start diving into the presentation, I want to just tell you a little bit about me. So how I started down this path was after I had my daughters, I never lost the weight. And then I gained more weight throughout my 30s. By the time I got to be 40, I was really overweight. And here's some pictures of me, but they're actually not at my highest, believe it or not. I avoided cameras at all costs. So I don't really have a lot of pictures. And even these pictures, I had to go through Facebook and look for them because I had none of me. I try to avoid the camera as much as I can. But anyway, so when I was 40, I went to see my doctor and she told me the bad news. You're pre-diabetic, you have high blood pressure, your cholesterol, especially your triglycerides are through the roof. You know, you're overweight, your asthma is getting worse, you're just a mess, pretty much. Now, diabetes runs in my family. Did I ever think I was going to get it? Yeah, it passed across my mind, but it really didn't sink in that it could be me. Now, all this time I was working as a manager and I was managing pharmacy in the hospital and an organization, and it was very stressful, right? So this all took place, and she gave me 3 months, told me, come back and we'll see if you're still not better. We'll start you on medications. 3 months later, I was even heavier. My blood pressure was even worse. And so I started I went from 0 medications to now being on at least 3 or 4 medications at the time. So I really had to think about my life. I had two young kids that, were coming into teenagers, and I did notice that they were getting a little heavier. My husband was certainly heavier. I was heavier. So we were not in good shape. So, I know all this stuff. Unfortunately, just like doctors, we don't get a lot of nutritional education in pharmacy school. So I went on my own to try to find more stuff. In the meantime, I changed my job. I became a clinical pharmacist, and I started to help treat patients with chronic disease. So I was in a clinic with a team, and I managed those patients' medications and help educate them on their chronic disease. I was able to stop junk food and soda and all that stuff. I lost about 20 pounds, certainly got better, was off most of my medications except my blood pressure medications. She wanted me to continue. And for a while, we kept trying to eat better. Exercise has always been a problem for me. So that was always something that weighed on me because I couldn't get myself to do it on a regular basis. We were all doing better. My husband lost a ton of weight right away. Of course, men do that. And, I just couldn't lose any more weight after that. And I still wasn't feeling great. I was still feeling tired. So I went looking for more. So that's when I found functional medicine. So we'll talk a little bit about functional medicine, and I started to make some more changes, very focused changes to my nutrition. And I developed this system that I base all of our services on RX Health and Wellness. And we can talk about that a little bit later. And it really has worked for me. At one point, I became a diabetic when my mother died. It was the stress. But ever since, I've been able to stay to have those sugars be really well controlled. My A1C is down to 5.2, which is normal. My blood pressure is much better than it has ever been. My doctor is considered taking me off the medication now. She's always worried because it could always go back up. But other than that, I'm not taking any medication, just my blood pressure medication. So my goal is to be able to help women just like me who are over 40 or have chronic disease to reverse that disease and feel better than they have in years. All right, so let's get going with the presentation. So what are we going to talk about today? So of course, we're going to talk about what is functional nutrition. But to understand that, we'll need to talk about what is functional medicine. We'll need to talk about the true causes of chronic disease. What is cardiometabolic syndrome? The 7 systems of functional medicine. And that will help us really understand how food impacts those systems. So those, you'll talk about the microbiome and food, immunity, inflammation, and food. We'll talk about food and energy. I'm sorry, I skipped one. Immunity and inflammation and food. Food and energy, food and detox, food and communication, food and hormones, food and mood connection. And we hope by the end you'll understand why we say that food is medicine. All right, so we're going to start with functional medicine. So what is functional medicine? So functional medicine asks how and why illness occur and restores health by addressing the root causes of the disease for each individual. So to understand that a little bit better, diabetes is what we call a group of symptoms when people have high blood sugars. But high blood sugar is not the cause, it's the result, it's the disease itself. So we need to find out what's causing those high blood sugars and reverse that disease. So it's an approach to care that views health and illness as part of a continuum. So we're not all healthy and we're not all sick. So we are just somewhere in between that continuum between being healthy and being sick. All components of the human biological system interact with another. So we see it as a one big complex system. We don't see just your kidneys. We just don't see your heart by itself. We know that this is a big, very complex system that we need to address in order to get you healthy. Okay. So here, when we talk about disease, we're talking about chronic disease. We're not talking about acute or emergency type diseases, like when you need surgery or when you are in a car accident. Our modern medicine is great for those things. They are at their peak. But when it comes to chronic diseases, they're not doing so well, right? They're just not doing good. So what we think is for chronic diseases, most of it comes from inflammation and obesity. Now, we'll talk a little bit more about how and why we think this way, but it's chronic diseases that we're talking about mostly. Okay. So what would be a better approach to find the cause and then remove what's causing the disease? So functional health, functional medicine focuses on the root causes, right? So we try to find exactly what's going on and we try to restore health. Now, it sounds complicated, but it's actually pretty a simple approach that we take in restoring health. We take out the bad stuff and we replace it with good stuff, and we allow your body's natural system and healing mechanism to do the rest. So now there is a caution here. There are certain diseases that progress and beyond a point, they cannot be reversed. So, for example, diabetes. Once you've burned through all your beta cells, those are the cells that make insulin, you cannot replace them. You cannot grow other beta cells. So really at that point, you will need to have insulin in order to live. Now you can restore and get as healthy as you can at that point, but you'll never be able to get back to when your body was making insulin itself. So just keep that in mind. But for most diseases, we can improve your health greatly. And for a lot of you, we can reverse the chronic disease. Okay. So what are the triggers that will trigger disease, right? So triggers are things that will interact with your genes and your biological networks, and they can either trigger things that are good for you or trigger things that are bad for you. So in addition to these triggers, there are necessary ingredients for health, like real food. And when I mean real food, I mean whole food, nothing processed, and certainly no junk food. nutrients, hormones, lights, water, air, rest, rhythm, sleep, movement, love, connection, meaning, and purpose. So we need all of those. All right. So disease occurs when you have too many triggers that are bad triggers and not enough of the right ingredients. So not enough of the good triggers. Creating health is simply a matter of identifying what are bad triggers and removing them and replacing them with good ingredients that will improve your health. So what is the true cause of disease? So for over 40 years, we have known that there are modifiable risk factors that can affect our health. We often hear that the major causes of death are heart problems, cancers, and stroke. But these are often the result of these modifiable risk factors like smoking, the SAD diet or the standard American diet, and no exercise. So what would you say if I told you that 80% of all chronic diseases and premature deaths in the United States and around the world are preventable? Preventable, I mean preventable. You might be very skeptical. If that was true, why aren't we doing something to correct it? So we are. We often in standard medicine will tell patients to eat better, have a better nutrition, but patients don't understand what that means. And they really would like more of a pill that can solve all the problems. Unfortunately, there's no such thing. So lifestyle medicine has become a really big deal in order to get people to be more healthy. Okay, so for example, smoking. So starting in the 50s and 60s, we learned about the dangers of smoking. And despite all the publicity, many people still smoke. When the information first came out, big tobacco companies tried to confuse us, and they really made a mess. So people couldn't understand what was true and what wasn't. But today we know that if you stop smoking, you reduce your risk of cancer, such as lung cancer, reduce your risk for cardiovascular disease, such as heart attacks and strokes. You can also reduce your risk of chronic diseases, such as COPD and asthma. And we know the same about diet and exercise, right? So it's kind of the same situation with nutrition. So big food companies that have billions and billions of dollars invested in products that are prefabricated, full of chemicals and preservatives, they don't want you to know about this because they would lose a lot of money, and they are very powerful. They're as powerful as the tobacco company was, or even more. And they're actually part of the tobacco company. So the food and the tobacco company are now one. Okay, so giving that information out is hard, right? So let's talk about what is metabolic syndrome. So we know cardiometabolic syndrome, sorry. So we know that cardio refers to your heart. So that includes all the systems that have to do with your heart, with your circulation, and even strokes. Metabolism, on the other hand, is how we use food to convert it to energy and how efficient we use that food to not only get the energy we need, but all those good triggers and good ingredients that our body needs to be able to function correctly. All right. This is a quick slide just to show you what the requirements are to be diagnosed with cardiometabolic syndrome. These guidelines are old, from 2005, but they've not been updated. So if you have any of the following 5, then you're considered to have cardiometabolic syndrome. So if you have an increased waist circumference, that means greater than 35 inches for women, greater than 40 inches for men, and you have either increased blood pressure. Now here, blood pressure, you may go to your doctor and he says, 130 over 85, that's great, love it. But really, blood pressure should be closer to around 120 over 80. Or you have fasting blood sugars. So if your fasting blood sugars are higher than 100, you're actually considered to be pre-diabetic, but you're also considered to have, if you have 2 more of the 5, you're also considered to have cardiometabolic syndrome. If you have high triglycerides greater than 150, or if you have a low good cholesterol HDL, less than 50 for women, less than 40 for men. So if you go back to the story that I told you about myself, I was really overweight. So my waist circumference was really big. It was nowhere near 35 inches. I had high blood pressure, so I already have 2. Then my sugars were going up. I was told I was pre-diabetic, so that's 3. But I didn't stop there. I also had the high triglycerides and the low good cholesterol, the HDL. So I actually had all 5 when I went to see my doctor. So let's talk about this this slide, because it's very busy, right? So cardiovascular syndrome is, again, we don't see people as being either completely healthy or completely sick. So this is a continuum. So where you have insulin dysfunction is where most of these diseases start. And so these diseases include obesity, sarcopenia, or problems with osteoporosis and joints, non-alcoholic fatty liver, type 2 diabetes. Type 3 diabetes is what they're calling now Alzheimer's disease. Cardiovascular diseases like heart attacks, heart failure, or even strokes are included in that. And then hormonal problems like PCOS, cancers, and osteoporosis, right? So you start with insulin dysfunction because of triggers like the SAD diet, and then you move throughout this continuum to where you can be very, very sick. So this is all cardiovascular disease, cardiometabolic disease syndrome. Okay, so let's talk about the 7 systems of functional medicine. So here are the 7 systems of functional medicine. So assimilation, that includes digestion, absorption, microbiome system, digestive system, and respiration. The second is defense or repair, that includes your immune system, the inflammation system, infections, and microbiome again. So The first is the gut microbiome. The second microbiota is we actually have microbes everywhere, and we have microbiomes for each of our organs, and it's more complicated than we ever thought. Energy is number 3, energy regulation, and that has to do a lot with the mitochondria, and we'll talk about that. Number 4 is biotransformation and elimination. That's the detoxifying, and we'll talk a little bit about that. Transport is the circulatory system, your cardiovascular system, and your lymphatic system. Communication is your endocrine system. So that are your sex hormones, your pituitary, a whole bunch, neurotransmitters and immune messengers. And your structural integrity from your cells to your musculoskeletal system. So in functional medicine, we recognize that the body is not organized by medical specialties. So we don't see it as cardiologists and renal doctors. We see it as a big, complex system. So we see those specialties more like a branch and the leaves of the tree, which is your complex system, right? And that's where disease lives. So what drives all the disease imbalances is the fundamental network underlying all the disease, all that complex system. And then those networks are always changing depending on what triggers and what things you're doing with lifestyle, and also the response from your genes. Okay, so we're going to start with the microbiome, your gut, and the food. So it turns out the microbiome is a kingdom of microbes that is living in your gut. And it's probably the most important thing that we've learned in the past 20 years, because these microbes help us either improve our health or damage our health. So the bacteria in your microbiome outnumbers your own cells 10-1. And bacterial genes outnumber your own genes 100-1. So an unhealthy microbiome can lead to heart disease, cancer, diabetes, obesity, asthma, autoimmunity, dementia, allergies, fibromyalgia, Parkinson's disease, skin disorders like eczema, acne, psoriasis, not to mention all the digestive disorders that are that include irritable bowel syndrome, reflux, colitis. But a healthy microbiome can help you not only heal those conditions, but is the key to your health in many instances. All right, so is your food medicine or poison? Okay, so bad gut bugs grow for 2 reasons. So the bugs, the bacteria that are not good for you, that will damage your health. They grow because you're not eating enough of the foods that feed the good guys. So if you feed the bad guys, they grow, and the good guys die off. And eating too many gut-busting foods will, again, kill the good bacteria. The biggest culprit is gluten. Modern wheat has powerful inflammatory proteins called gliadin that create a leaky gut. So unfortunately for us, we have modified food so much that we took something that was good and great in a very long time ago and made it worse. So by modifying wheat, modern wheat, we get a lot of the bad stuff and we don't get any of the good stuff. So most wheat today is sprayed with weed killers like glyphosate, bad names, hard to say, at harvest to dry out and to keep bugs from them. So things like your morning Cheerios have glyphosate. They also have vitamin B12 and vitamin D. But does that make them healthy? No, because that vitamin B12 and that vitamin D is added to it. It doesn't come from the actual wheat that the Cheerios are made. And aside from being bad for you, the wheat, we just talked about being inflammatory, glyphosate itself destroys your microbiome. Other foods that are not good for you include sugar and starch, right? And there's like complex starch and the simple starch. And there's wide, ultra refined processed starch, which is really bad for you. Okay, so the bad bacteria in your microbiome, they love all these foods that contain all these sugar and starch and modified wheat. So they promote overgrowth of the toxic bacteria and yeast. And they're probably the reason a lot of people get the food baby after a large meal. Refined oils, which make up about 10% of our calories, also lead to leaky gut and trigger something called metabolic endotoxemia. In other words, your metabolism of these foods is poisoning you by creating toxic byproducts and bad bacteria. All of these things will lead to obesity and type 2 diabetes. Where good fats like omega-3 fats do the opposite. They actually improve your health. So in addition to the bad fats, we overconsume additives and preservatives. Some of the worst are thickeners and emulsifiers, which is used for a lot of the processed food. And these include things like carrageenan in gums, and they can also cause leaky gut and autoimmune disease. So things that are not good for you. Okay, so gut healing foods. So what do we feed these microbiomes to get the good guys going? We feed them fiber. So you need to increase fiber in your food. Fiber is called a prebiotic because guts will turn them into probiotics, which is the food that they want to have. So certain foods have higher levels, including things like artichokes, asparagus, plantains, seaweed, and a lot more. So fiber will increase the good guys, and that means eat more vegetable, fruits, nuts, and seeds, and whole grains and beans. We know that the right foods will feed the right bugs in your gut and keep your gut barrier lining intact, so no leaky gut, and it will protect you from getting sick. All right, so another thing that you can do is have probiotics, and probiotic rich foods are things like sauerkraut, pickles, tempeh, miso, matto, kimchi. A lot of these foods were not things that I used to eat regularly in my diet. But a study found that Polish women on average eat about 30 pounds of sauerkraut per year in Poland, When they moved to the United States, they dramatically decreased the amount of sauerkraut that they were eating. And that result showed that those who were not eating as much sauerkraut actually had a higher incidence of breast cancer. So this might be things that you are not used to eating, but maybe you can give them a try. Okay, so another thing that we can feed our good gut bugs is polyphenols. So we discover that the microbiome involve these polyphenols have a role in your microbiome. So the more colorful the nutrients, the foods, the more phytonutrients you'll find. And most of these come from plants. So the good bugs love to eat plants, especially very colorful plants. So one of the things we recommend is eat the rainbow, right? So, for example, there's a good bug in your microbiome called Akkermansia. It loves cranberries and pomegranates and green tea. And when it gets these foods, it creates a protective layer in your gut, preventing leaky gut, and improves autoimmune diseases. Things like heart disease are improved and diabetes. So if you feed the correct bugs, the good guys, then it will help improve and even prevent things like cancer and immune disease. So your gut also needs other nutrients like zinc that you can get from pumpkin seeds and oysters. Omega-3 fatty acids we talked about, such that come from fatty fish, like salmon and herring, and can help improve inflammation as well. Vitamin A also comes from cod liver, salmon, and goat cheese. And vitamin A is very important to heal your leaking gut. Foods that contain collagen, such as bone broth, contain something called glycosaminoglycans, which also help your gut. So those are good things to have to improve any symptoms you may have from your gut problems. Okay, so food is the most important regulator for your microbiome. So with foods, you can grow the good bugs or you can feed the bad guys instead. So remember, next time when you take a bite, you're not just eating for you, you're eating for the microbiome and for your health, right? So I hope you'll incorporate some of these foods into your diet. Okay. Immunity, inflammation, and the food connections. So what do all modern diseases have in common? So we talked a little bit about this when we were talking about the cardiometabolic syndrome, and that is inflammation. So things like depression, cancer, heart disease, obesity, diabetes, dementia, allergies, asthma, chronic fatigue, autoimmune disease, and a lot more inflammatory diseases, they all are inflammation based. So what causes inflammation? So here's one of the culprits: sugars and starches. So high levels of sugars and starch are the main drivers of inflammation. Sugars and starches will spike your sugars, which in turn will make your body spike insulin. Insulin will trigger a cascade that can harm your body if you keep it going all the time with the ingestion of sugar and starch. It drives sugar and starch to be stored in fat cells called adipocytes in your belly and around your organs. So why do we worry about your abdomen and how big it is? It's because it's an indication of fat being on top of your organs, which makes them have a hard time working the way they're supposed to. And this is not just any fat, it is what we call super fat, because not only it causes changes in your metabolism, and it causes disruption in your hormones. And it leads to inflammation. So these adipocytes, they will drive increase insulin in your body, which can lead to changes in your body. So if you have a lot of insulin, then your body starts becoming resistant to the insulin, right? So you need more. So actually you end up even increasing more because now you're resistant to that insulin. So things that can affect that resistance are things like alcohol. So more and more alcohol will increase more and more insulin resistance and will drive that fat storage, and it will drive inflammation. Now, sugar also drives inflammation, and on top of that, sugar and starch suppresses your response, your immune system's response to infection. So your immunity is decreased. Now, sugar and starches also lead to leaky gut, which triggers a reaction in your body that can also lead to more inflammation. Okay, so let's talk about fats. So there are good fats and bad fats. So here we're going to talk about bad fats. Bad fats may be another trigger to inflammation. Now, there's a lot of debate whether how much of it increases our response to it, especially in that the good fats like omega-3 fats help us, but omega-6 fat actually increases your inflammation. So omega-6 are found mostly in nuts and seeds and other plants. But their omega-6, is also found in all refined oils and these types of foods. So if we eliminate most of these bad foods and start eating more of the foods that contain omega-3 fats, which is an anti-inflammatory, that's the way to go. So my recommendation is to get your omega-6 fats from whole foods, because your body will tend to convert those omega-6 into omega-3. So those are the ones that comes from nuts and seeds and unrefined oils. Get more omega-3 from fish like salmon and whole foods, right? So people who get their fats from whole foods do better than the people who get the bad fats from these types of foods. The other main trigger of inflammation in our diet are food sensitivities, which can fuel a low-grade chronic inflammation. So these sensitivity, this food sensitivity causes the leaking gut, right? So when you have a leaky gut, the spaces in your gut become separated and foods can go in, creating this sensitivity reaction to it. And it triggers your immune system, which in turn then triggers inflammation. So the most common foods that create these kind of reactions are gluten, dairy, grains, beans, soy, eggs, nuts, seeds, and nightshades. Often healing the gut will mean reducing these foods or eliminating them for at least for a while, a period of time, such as six weeks, to give your gut some time to heal. That also will drive the inflammation down. Okay, so let's talk about anti-inflammatory foods. So anti-inflammatory foods can be very powerful in bringing down that inflammation that we talked about. There are as many as 25,000 plus phytochemicals that are considered to be powerful anti-inflammatory. These polyphenols are in plants and they come from nature. So it's great. So we have everything we need in those foods. So the best places to find these phytophenols, it's in the rainbow. So the more colorful your vegetables are, the more pigment and color that they have, the more red, green, yellow, orange, purple they are, the more anti-inflammatory they are. Extra virgin oil, olive oil, but it has to be extra virgin, contains something called oleocanthal, which activates the same anti-inflammatory receptors that ibuprofen does, but with a lot less. Other foods that you can use for inflammation are things like spices. They're very powerful, even in small amounts. And they include things like turmeric, ginger, and rosemary. So there's been studies where they found that meat cooked with spices can potentially neutralize those bad fats that lead to inflammation. Omega-3 fats that are found in the wild foods like fish, seafood, some nuts and seeds are also very powerful anti-inflammatories. Mushrooms, things like shiitake mushrooms, maitake, reishi, shega, turkey tail, and cordyceps, they all contain immune-regulating compounds and anti-cancer compounds called polysaccharides. And foods that are rich in vitamins and minerals boosts not only immunity, they will reduce inflammation, and these include vitamins like vitamin C, minerals like zinc and selenium, other vitamins like vitamin D. So vitamin D alone regulates hundreds and hundreds of your genes, and that will help with inflammation and immunity. So maybe consider including more of these foods in your meal. Okay, so the best thing you can do for your health, again, is to cut down or cut out those foods that are inflammatory. So one of the things that we recommend highly is decreasing red meat, right? Red meat has a lot of that bad fat and leads to increased inflammation. So we want to cut down on those foods and increase more of the anti-inflammatory foods that we just talked about. Okay, so food and energy connection. So most of us understand that what we eat provides the energy that we need to move and live. But here's the rundown. The food that you eat breaks down into fats, protein, and carbohydrates. And these are the macronutrients, and they're the ones where we can get most of our energy. So the oxygen that you breathe combines with these nutrients in tiny little factories called mitochondria inside the cells. And the food and the oxygen produce the energy that your body uses, and it's called ATP. Okay? It powers everything. We could not do anything without this process. Some foods burn cleaner than others and create a lot more energy, and others create more exhaust that damages our tissues and cells. They produce what we call radicals, and these radicals cause what we call oxidation. It's like rusting and inflammation. So our body produces its own antioxidants to protect us from this damage, but often our body's antioxidant system can't keep up when we eat too much sugar or starch or processed foods and not enough of the good foods that the body needs to do this antioxidant process. So the key to longevity and health is optimizing your mitochondria, giving the mitochondria what it needs so it can produce good, effective energy. And most of poorly functioning mitochondria are found in people who have chronic disease, including obesity, diabetes, heart disease, dementia, Parkinson's, chronic fatigue, and fibromyalgia. It also shows up as symptoms like fatigue, foggy brain, weak muscle pain, not being able to tolerate exercise, and it ages us rapidly. Okay, so, sorry, gonna take a drink. Been talking too much. So how we feed our bodies affects the number and function of our mitochondria. So while environmental toxins can affect our mitochondria, same as infections, those food allergens and sensitivities, the unhealthy microbiome, and nutrient deficiencies, they can all damage your mitochondria, and they are the biggest, but the biggest factor here is food, the food that you eat. Okay, so at a conference, I was hearing from Leonard Guarente. He's a researcher from MIT. He's the one that discovered the sirtuins. Those are like regulatory genes that affect aging. The shorter your sirtuin, the older you are. He said the biggest impact on these key regulatory genes, on these sirtuins, is sugar and refined starches. They make them shorter, so they age us. Americans eat nearly a pound of sugar and flour a day, which may partly explain why life expectancy is going down for the first time in history. The other problem is just too much food. We tend to eat a large amount of food. We supersize everything. We never give our engines a rest. So the gut needs to rest. your body needs to rest, to reset, and to restore. But if we snack all the time, especially late at night, and Americans tend to binge at all hours of the day and night. So since 1961, the average American consumes an extra 720 calories a day. Calories that have to be stored and burned, otherwise they just stay stored and you're growing bigger and bigger. Calories that have to be stored or burned are overwhelm our mitochondria, our energy factors. They tend to produce more waste and more free radicals than what our bodies can handle. So during the same period, obesity rates in America, so since 1961, climbed from 5% to 42%, more than an 800% increase. That's a huge increase. So here's a picture of your mitochondria. Your mitochondria are like little hybrid engines that can run on two fuel sources, fats or carbohydrates. Most of us fuel our metabolic engines with carbs, which produces more of the dirty, inefficient fuel instead of the clean burning fat fuel. And again, I'm talking about good fats, not bad fats. So bad fats like trans fats and oxidized oils, especially from deep frying, harm our mitochondria. However, good fats, called ketones, are the preferred fuel for our mitochondria and help them repair and renew and rebuild. Okay, so let's talk about longevity. So the new science on longevity has identified key mechanisms that gets turned on when our bodies are on an starvation mode. Anything that mimics starvation, including calorie restriction diets, which can be very challenging to do. What we and I recommend more is restrictive eating, which means eating only for 8 or 10 or 12-hour window, and then resting the rest of the time. There's also intermittent fasting, which is limiting calories a few days a week. So you pick 2-3 days per week and you limit the amount of calories that you intake. So those would be things like ketogenic diets and fasting mimicking diets, which is they have like 5 days of caloric restriction and 2 days where you can eat anything. They all do the same thing. Essentially, when you eat and what you eat comes together to supercharge your mitochondria. So that, in turn, means that our bodies are exquisitely adapted for starvation. In fact, we need a little scarcity to clean house. So we need to stop eating in order to rest, to improve our system. When there's lack of food, we switch to a fat burning system, and it leads to weight loss. When there's a lack of food, we switch, just reading the same thing, got lost. We have weeks worth of fat stored in our bodies. So if you restrict eating, for example, you're not going to harm your body. Okay? So when we burn the fat in our bodies, like with the ketogenic diet or restrict eating or fasting, mimicking any of these, our cells clean up waste and debris. They recycle all parts to make new cells, activate our antioxidant and anti-inflammatory systems. They get rid of toxic belly fat, and that's the fat that sits on top of your organs, increase muscle and bone, heightens brain function, and for many of these is a key to staying younger and not growing older. That remains to be seen, but it is, if you want to improve your health, you can consider some of this. That reminds me, for those of you who are here live with me, you'll get a copy of my book, Fasting, and I will put where to get it at the end when we finished everything, and you'll be able to get a copy of it for free. It's about a $19.99 cost item. But restrictive eating, that's my recommendation. Okay, so most of your mitochondria is in your muscles. So diets that can cause muscle loss, like high starch and sugar, low protein diets also leave us with poor functioning mitochondria. We especially need more protein and higher quality protein as we age, because we tend to lose more body muscle. Additionally, we need the right ingredients to supercharge our mitochondria. So we need things like vitamin Bs, coenzyme CoQ10, carnitine, zinc, magnesium, selenium, omega-3 fatty acids, lipoic acid, N-acetylcysteine, vitamin E, vitamin K, and many others. We also need to improve our oxygen intake. So that's where breathing comes in. So our modern nutrient depleted diet, our SAD diet, our standard American diet, provides very little of these things for the mitochondria. So the mitochondria is not getting what it needs. So to feed your mitochondria, include things like blueberries, pomegranate seed, grass-fed beef or wild beef, although again, very small amounts. Broccoli, sardines, extra virgin oil. Now, butter, real butter, but again, in very small amounts. Things like avocados and almonds. These are the best fuels for your mitochondria. And there's an oil called MCT oil, or medium chain triglycerides. It is one of the cleanest burning preferred fuel sources for your mitochondria, and it's an excellent performance enhancer before exercise. So you can use it before exercise. Okay, so learning to feed our mitochondria well, using clean burning fuels, avoiding sugars and starches, increasing our good fats, again, good fats, and not bad fats, and ensuring optimal levels of key nutrients can provide a ramp up to your metabolism. And don't forget oxygen, good breathing techniques. Combining that with mini breaks using time-restricted eating can have a powerful effect on your health, even maybe rejuvenating your health, energy, and longevity. So feed your mitochondria the correct thing. Okay, So we're going to talk about food and detox connection, and I should start getting faster because we still have a lot to cover. All right, so our body actually detoxifies all the time, and it keeps us alive and healthy. And that's the purpose of your liver. So if your liver fails, you can't process waste, and you end up looking yellow from having jaundice and needing a liver transplant. So for people who drink a lot of alcohol, that's what happens when they get cirrhosis. If your kidneys stop working, you can't process water waste. So that's another way of detoxifying, through your kidneys. And you can get very sick and die in a week or two without dialysis. So when people have kidney failure, that's why they need dialysis. If your colon is clogged up, well, you get the idea. You can't get rid of all of those toxins. Okay, so more than 80,000 chemicals have been introduced into our environment since the Industrial Revolution. And most have never been tested to see if they're safe, to see if they cause inflammation, oxidative stress, damage to the mitochondria, or disrupt our gut function, or create hormonal imbalance and overload our detoxification systems. So for most of them, we have no idea why they do. But many of our common diseases are linked to an overload of toxins, including heart disease, diabetes, cancer, and dementia. Environmental toxins have even been dubbed obesogens, which means they can cause weight gain, autogens, which means they can cause autoimmune disease. So we want you to eat to boost your detox pathways. So the food groups that best boost these pathways are cruciferous vegetables like broccoli, collard greens, kale, cabbage, Brussels sprouts. Now, if you don't eat these foods, just start slowly, because if you don't have a good gut microbiome, they will create a lot of flatulence. So these family of vegetables, as well as garlic, onions that contain sulfur compounds, will enhance the production of glutathione, and that's the body's master antioxidant. Glucosinolates, sulforaphanes, and carbinol, all used during detoxification. The liver also needs adequate levels of vitamin B, folate, manganese, magnesium, zinc, selenium, and amino acids to facilitate all the chemical reactions that it needs for detoxification. So where can you find these liver supporting superstars? You can find them in some animal proteins, seafood, nuts, seeds, and green veggies. Oh, sorry, I went too far. Didn't finish here. And veggies. So the good news is that foods that contain nearly all the ingredients that our body needs to eliminate waste are found in plant foods and animal protein and seafood. You also need plenty of water to help remove waste through the kidneys and gut. Fibers will help you remove waste through your colon. Our liver system is a little bit more intricate. So the liver has many pathways to remove toxins from the body, with fancy names such as methylation, glucuronidation, acetylation, and glutathione conjugation. But each of these pathways needs support, largely provided by those phytonutrients that are found in plants. So what does that say? Eat plants. Great, eat plants. All right, so food is both a good solution, but it's also a cause of overload in our detoxification system. So make sure you're adding high quality protein, tons of phytonutrients, vitamins and mineral rich foods, lots of plant-based foods, along with a lot of fiber and fresh, clean water will help you detoxify and will help your liver do its job. Okay, the food and communication connection. So our transportation system, our circulatory system, all the blood vessels, and our lymphatic system, and it's a parallel vessel to the vessels that clear all the metabolic waste from your tissues and return it to the heart to be cleansed by the liver and the kidneys. So every second of every day, your body is sending and receiving messages. It's what allows your body to process information and function the way it's supposed to be. There are many different types of messages, like those that allow you to process pain, movement, hunger, and like that will tell your vessels to constrict, dilate as part of your fight or flight response. Sorry, again, I keep doing the same thing. Okay, but how do all these messages get to where they need to go? How does the food you eat and all the nutrients it contains finds where it needs to go? And how does your body clears all that waste? So it uses our transportation system, our circulatory system, those are all the blood vessels, and the lymphatic system again. All right, so the biggest killer in the world today is cardiovascular disease, which is mostly caused by insulin resistance. Remember, think back to the cardiometabolic syndrome. So it causes prediabetes, type 2 diabetes. It can clog your arteries and cause heart attacks, strokes. It can lead to amputation in diabetes and even dementia. And contrary to popular understanding, this is not a plumbing problem that can be fixed by bypassing your rotor or your rotor. I'm bad with images. So, like doing angioplasty or bypasses or stents, that's not going to help anything. It's not the cholesterol per se that is the problem. Cholesterol is the byproduct. It is all the inflammatory and hormonal changes that turn on that cholesterol into plaque and clog your arteries. So what causes the inflammatory and hormonal chaos? Our diet. Believe it or not, that's the biggest culprit is your diet. While environmental toxins, stress, our own microbiome, and genetics, they all play a role. It is our diet that is the biggest driver of cardiovascular disease. And that's one of the reasons why I focus on cardiometabolic disease. Studies have shown that significant percentage of all heart disease can be prevented just by changing our diets. So here's one study. So studies have shown that even a single fast food meal can harm your blood vessels. But much of the adverse events can be offset by consuming phytonutrients and antioxidants. So colorful rainbow foods can actually help improve your cardiovascular system. It may very well be what we need to decrease the amount of deaths from cardiovascular disease in this country. So eating a nutrient-dense whole foods diet rich in phytonutrients helps prevent the damage in the first place. Interestingly, studies have shown that harmful effects of eating meat are neutralized when it's consumed with lots of spices and phytonutrients. So if you're someone who cannot not eat meat, then make sure you're eating more of the other foods like phytonutrients. But again, decreasing meat is probably the best thing that you can do. All right, so food and the hormone connection. So the biggest obstacle to better health is hormonal disorder that we face with insulin resistance. Again, cardiometabolic syndrome. 1 in 2 Americans has prediabetes or type 2 diabetes, and 75% are overweight. We're all suffering from too much insulin. The rest of the mountains of sugar is the result of mountains of sugar that we consume every day, not just sugar, but flour too. Insulin overloads and creates a domino effect that drives your inflammation again. All those excess calories will be converted into fat cells that produce messengers that will not only increase your hunger, slow your metabolism, prevent fat burning, and increase again inflammation. In women, too much insulin turns into estrogen and then into testosterone. The result is something misleading called polycystic ovarian syndrome, or PCOS. It is not an ovarian problem, it's a dietary problem. We need to decrease insulin resistance. The extra testosterone in women will cause things like hair loss, facial hair, acne, infertility, and a host of other things. In men, testosterone gets converted into estrogen, which is why men get big bellies and have man boobs, have low testosterone, low impotence, and loss of hair in their body. So the same high sugar and starch diet also spikes their hormonal cortisol. And you know about cortisol, that's your flight and fight hormone. So when you eat sugar, your body literally perceives it as having stress, like when a tiger is going to attack you. So adrenaline and cortisol are increased, worsening insulin resistance and increasing cravings for starch and sugar. Again, the cure here is whole foods, good fats, plant-rich phytonutrients, fiber-rich, low glycemic, and phytonutrient-rich, again, plant foods. All right, many hormonal problems also result from imbalances in sex hormone metabolism, including menopause, PMS, and female cancers. We live in a culture that drives excess estrogen and increases toxic estrogen in the body. Too much sugar, low fiber diets, nutritional deficiencies, alcohol, xenoestrogens. Those are things that you can find in things like pesticides, plastic, environmental chemicals. They all mimic estrogen. Also, stress and lack of exercise they all can drive hormonal imbalances. Estrogen is metabolized and excreted to your liver and your bile. So if you're constipated or you have an unhealthy gut microbiome, then that estrogen gets reabsorbed and reused, leading to things like breast cancer, uterine cancer, worsening PMS and menopause symptoms. Certain fibers, for example, like flaxseed, contains lignans, which help detoxify and improve estrogen metabolism and reduce cancer. Okay, the thyroid disorders. So thyroid disorders is also affected by what we eat. 1 in 10 men and 1 in 5 women, so it's more women than men, have low thyroid function. Low thyroid function can be triggered by things like gluten and diets low in zinc, selenium, vitamin D, and iodine. Environmental toxins often found in our food, such as pesticides and mercury, also damage our thyroid. Adding foods that are rich in zinc, like pumpkin seeds, selenium, which can be found like in Brazilian nuts, vitamin D, which you can get from the sun or porcini mushrooms, and iodine, which you can get through eating fish and seaweed, can help optimize your thyroid function. As you can see, our hormones and messengers are highly influenced by what you eat. The biggest factor impacting your communication system is reversing that insulin resistance. So if you can do that, you can decrease the biggest cause of death in the United States and worldwide, which is cardiovascular disease. So the good news is that reversing insulin resistance starts with just 1 bite of the right foods. Okay, so food and the mood connection. The link between diet and brain health is profound. You name it, food plays a role in everything, from depression, anxiety, ADHD, dementia, behavior problems, violence, or just the old brain fog. Is all connected to what you eat. Whole new research, such as nutritional psychiatry, have emerged since 2009. Stanford has a department of metabolic psychiatry. Harvard now has a department of nutritional psychiatry. Studies have shown that simply swapping out processed and sugary and starchy foods for whole foods is effective in treating depression. It's not just me telling you that food heals everything. It is real. Studies have also shown that kids with severe violent behavior can transform when swapping out processed foods for whole foods, including a 75% reduction in the use of restraints and 100% reduction in suicides, which is the 3rd leading cause of death in that age group. That simply giving children vitamins and minerals that they need via supplement is not enough. You need to give it via food. Okay. The most common deficiencies I see are related to brain disorders. That are related to brain disorders include omega-3 fats, magnesium, vitamin D, zinc, selenium, and vitamin B. Omega-3 fats in particular are critical for brain health. 60% of your brain is made of DHA, an essential anti-inflammatory omega-3 acid, fatty acid. If your brain is on fire, you're likely fat deficient. So you need omega-3 fats to form the basic structure of the cells of the membrane. Your body's messenger molecules won't be able to communicate and your health will suffer. While therapy, stress reduction, movement are equally critical in brain disorders, food plays a pivotal and often overlooked role. So start small, eat veggies. So load on veggies, eat fruits. So try the low sugary, nutrient dense ones. Whole grains, no flours. Nut and seeds, low starch. Beans, legumes. Some high quality protein, focus on grain foods that have shown to impact the mood and reduce symptoms of depression and anxiety. So foods rich in omega-3s, zinc, magnesium, vitamin D, antioxidants, and vitamin B12. So food is what we are made from. So every cell in your body turns over about every 7 years. Some turn over daily, some weekly, and some take longer. Ever wonder how we make new cells, organs, tissues, skin, muscle, bone, and even brain cells? We don't just manufacture them from thin air. The raw materials come from what you eat. So do you want to be made of Doritos or do you want to be made out of phytonutrients? Do you want to be made out of Coca-Cola or wild berries? Our structure, which determines our function, is dependent on what we eat for the building blocks. Those are the proteins, fats, minerals, and more that make up who we are. We're not actually made out of carbohydrates, though, even though that is the biggest part of our meal and where we get most of our energy. So carbohydrates are not really considered essential nutrients. They're good for, again, energy, but your body's made out of 62% water, so you definitely need water, a lot of water. 16% protein, 16% fat, and 6% are minerals and vitamins, and less than 1% is carbohydrates, so very small amount. The problem is that our processed diet is about 50 to 60% carbohydrate and mostly very low bad quality, like starches and sugars. And this is not the good raw material to make for your body. So we burn some of that carbohydrate since it doesn't become part of your body. So we burn some of it, but most of it gets converted to fat, which is the bad fat that's in your abdomen. So your structure matters, not just to keep you all together, standing straight and up and not collapsing. Every part of you has a structure and a function. If you're made of poor quality parts, you will create poor health. Muscle loss, bone loss are huge factors in aging and age-related diseases. Muscle is where our metabolism takes place. Low muscle mass equals low fat metabolism. The effects of poor quality muscles is an increase in diabetes, inflammation, and aging. Imagine building your house out of rotten wood or disintegrated bricks. Remember the fable about building your house on sand? Or the one about the 3 pigs? Your structure and your foundation matters. Why would you build your body with defective ingredients or bad ingredients when you can build it out of great ingredients and create a great body? We need the best quality types of fats, good fats. Our brain is 60% fat. Our nerves, coverings are all made from fat. Every one of your 10 trillion cells is wrapped in a little fatty membrane. Those are cells. Do you really want to make them from bad, damaged, refined oils, like what you find in French fries or KFC? Or you want to make them from high quality proteins and great ingredients? The body makes most of its important molecules from proteins, including muscle, cell, immune molecules. Not all protein is the same. The best type of protein to build muscle is other muscle, like animal protein. So lean protein is what I'm talking about. You can get protein from plants, foods, which is good, still a good quality, but key amino acids needed to synthesize new muscle, especially the branch chain amino acid like leucine, isoleucine, and valine, and also lysine and sulfur are based on amino acids found in animal protein. But you want good quality animal protein, and again, not red meat. Okay, so next time you're chomping down on something, ask yourselves if you're fine with it becoming part of you for a long term. If not, don't eat it and find better quality ingredients that you can live with. There are also compounds such as phytates in plant proteins like beans and nuts that impair protein absorption rather than being turned into muscle. Plant proteins are often just burned as calories. If you are vegan, especially if you're of an older age, you need to ensure that you get these by increasing the overall volume of protein-rich plant foods, adding protein powders, and supplementing with BCAA. If you want to eat less meat and include more plant proteins, combining them helps the body utilize plant proteins from beans. Think chili con carne. Think chili. And don't forget all the vitamins and minerals that